Dr. Bharat Pankhania is a senior clinical lecturer at the University of Exeter Medical School and joins us now. Dr. Pankhania, good to have you with us as ever. So Chris Hobson seems to be saying there is some time, maybe just a few days, but some time to do something about the impact of Omicron on the NHS. Do you agree, or do you think that particular horse has already left the stable?
Within reason, I feel that the pulse of infections that are going to come our way has already occurred, because people will have been exposed and now they will be incubating it. And in the next couple of weeks, we will see that manifest as cases. Having said that, prevention is always good, and we should nevertheless continue to stop further cases from arising. And that would be good infection control measures like wear your mask properly, and of course be fully immunized.
So just let's talk a little bit more, if we may, about where we are at on the time lag between infections occurring and potential hospital admissions. And I say potential, although clearly hospital admissions are at a very high level. When I'm talking specifically about COVID, the early data on Omicron seem to be pointing towards it being less severe than the Delta variant. So where are we on that time lag between infections and potential hospital admissions?
So once we've seen the pulse of infections, there is usually a 2 to 3 week lag period before it manifests as hospital admissions. So the infections that are about to happen for the Christmas festivities, we brace ourselves for second, third week of January. And once we are past that second, third week of January, we will be in a better position to know if that big pulse has materialized into hospital admissions or not.
And in some ways, that's a moot point, because the latest figures do show that hospital admissions in England have risen to their highest level since January last year. So I suppose the question then becomes, at what point can the NHS no longer cope? And I feel that the good people, the good staff of the NHS, they are by nature copers. They don't want to get to the point where they say, we cannot cope any longer. So with Chris Hobson talking about the government must be ready to introduce new restrictions, and the Health Secretary saying new restrictions must be introduced as an absolute last resort, at what point do those two opinions meet?
I think that's divergent, really, because Annita, if we were to prevent further cases from rising, that would be a better thing for the National Health Service, because the National Health Service is not only working at full capacity, it is in trouble. The trouble is staff sickness and absences. So the staff absences have gone up dramatically in the last 2 weeks. Furthermore, staff who can return back to work cannot do so safely because of shortages of PCR and LFT testing. Therefore, now is the time to act to reduce the rising number of cases if we can do so.
The government, of course, is trying to factor in other considerations, the economy, allowing people who have been fully vaccinated and so on and gone through that programme of being vaccinated to be able to go out and about and enjoy their life in a relatively normal way. So how do you balance these two things? I mean, you're coming from the scientific, the medical point of view. The government is looking at that plus, many other perspectives. It's a difficult one to get the balance right, isn't it?
Whilst it appears difficult, I always feel economy and health go together, and we can make it work, but together. So what we have to do is, wherever possible, allow the infection control measures to come into play to reduce the rising number of cases. And for this, it isn't really restrictions, it is more better infection control measures. Therefore, work from home when you can, wear a better quality mask where you can, reduce your interactions in public places, and get fully immunized. All of those measures will reduce case numbers, and it doesn't harm the economy in any way.
Dr. Bharat Pankhania, thank you very much for your thoughts on all of that this evening. Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter Medical School and expert in infectious and communicable diseases. Well, due to the holiday period, the government's latest coronavirus figures aren't complete, and data for Scotland, Wales and Northern Ireland has not been published, but there were a record 162 1,572 new infections recorded in the latest 24-hour period in England alone, and 154 deaths. That's of people who died within 28 days of a positive COVID test.